Welcome to Medicare School Daily, where we help you understand Medicare, save money, avoid mistakes, and above all else, get the most out of your Medicare benefits. I'm doing a series right now called Avoiding Medicare Mistakes. And today's mistake and topic I'm going to address is this question here, thinking that Part A and B is enough. There are some people who choose to enroll into Medicare A and B only. And so let's talk about this. When you decide to go on Medicare, folks, what you have to realize is you're making decisions about your healthcare coverage. And there's several elements of that decision. Number one, you're deciding, based upon what you enroll into, what services are you going to be eligible for? What are the providers that you can go to, the doctors and the hospitals and those people that are going to take care of your healthcare needs? What will your premiums be? There's very few things on Medicare that are going to be free, so you're going to have premiums involved. And then also you're going to have, beyond premiums, out-of-pocket expenses. This would be deductibles and co-insurance and co-pays. And so when we make our decisions to go on Medicare and we're deciding what plans we're going to use, all of these things are going to be affected by that decision. Okay, so we have three different choices before us when we enroll into Medicare. Number one, you can decide to enroll into Medicare A and B only, meaning you decide you're not going to have any other insurance beyond just the A and B, and some people will choose that. Now, other people will say, no, I don't really like that option. I think I'm going to add to that A and B only a supplemental plan and a prescription drug plan. Okay, so some will choose option number two, all those services combined, and then others will choose an Advantage plan. Now, what happens when we have an Advantage plan is we don't have a supplemental plan and a separate drug plan. We have a replacement plan, and then they add to that a prescription drug plan, part of the package, all right? So those are our three options. So I'm not going to address this in here. The one I'm going to address during this video is those who choose to have Medicare A and B only. And the question is always, why would someone choose to have A and B only? Well, here are the reasons that people choose A and B only. Number one, because it is the cheapest as far as monthly premiums go, right? So it's the cheapest in premiums. The reason for that is because Medicare A is zero premium. As long as you paid into Medicare 40 quarters, they give you A for free. Now, B is not free, but B this year cost $144.60 a month. And if you're on Social Security, they take the B premium right out of your Social Security check. If you're not, they'll bill you for that times 3, so you'll pay that amount times 3, which would be a quarterly billing, all right? And so if I have A and B only, the only thing I have to pay is the $144.60. And so it's certainly cheapest as far as monthly premiums go. Now, I'm saying it's the cheapest overall if you have any health problems, but as far as premiums go, it certainly is. Now, the second reason people do this is because it's the easiest choice. They enroll in A and B and they're done. In other words, they haven't had to put much thought or planning into what is the best supplemental plan for them, or maybe the best Advantage plan or the best prescription drug plan. And so those that choose the easiest route, just go A and B only and don't make any other insurance decisions. Now, may I remind you, is the easiest way always the best way? And typically it's not. But it is one of the reasons people do that. And then thirdly, I want you to realize, though it's the cheapest and also the easiest, it is also the most risky when it comes to financial exposure. See, the problems with A and B only is the financial risk that's involved in that, and this chart shows you why. Now, I'm not going to spend a lot of time getting into this chart, but I want to make sure you understand that when you stay in original Medicare A and B only, A is hospital, inpatient, B is medical, called outpatient type services. And so you'll see that you have these gaps. You have these financial responsibilities, these liabilities. Medicare pays first, but they don't pay for anything fully, and they're going to pass some of those expenses on to you. So these are your liabilities or your gaps. And so on the A side of Medicare, I have 3. On the B, I have 3. On the A of Medicare, if I go to the hospital, I have to pay a deductible. Now, that deductible is my full out-of-pocket for up to 60 days in the hospital. But if I'm ever in longer than that, then I have daily co-pays that you're responsible for. So if I have A and B only, you're going to have to pay for those. If you go to a skilled nursing facility, which would be after a stroke or maybe hip replacement, Medicare agrees to pay everything for the first 20 days. But if I'm in longer than that, now I have a daily copay for the next 80 days. So those are my gaps on the A. On the B, we have a deductible. That is once a year, and after that deductible is met, then Medicare is going to pay 80% and you pay 20%. That's called co-insurance. Now, the problem with your co-insurance, it's totally unlimited. And the biggest problem is that's where all the docs are paid. The surgeons, anesthesiologists, the primary care docs, your specialists are all paid through B of Medicare, and your part's 20%. And if you had A and B only, that 20% never ever stops. And then the last gap would be if you go to a doctor that takes Medicare patients but does not take Medicare approved reimbursement rates as payment in full. A doctor like that adds to the bill. When they add to the bill, that addition is another 15%. And when that happens, you have to pay for that. All right, so those are your gaps in original Medicare A and B. So if we had A and B only, I'm totally going to be responsible for those. So as you can see, there's a huge financial risk involved in having A and B only. But there's also another risk involved, and that is called the Medigap eligibility. Now, what this means is that when a person goes on Medicare A and B, they're given a 6-month period of time where you can actually buy any Medigap policy that is offered in your state without any underwriting required. In other words, you could have serious pre-existing conditions, and that insurance company has to take you because during this 6 months, they can ask you no health questions. They have to approve your policy. So let's just suppose that I'm going to start my Medicare A and B in January 1, 2021. Remember, I have 6 months. No underwriting is required to get a Medigap policy. And so that 6 months would go all the way through the end of June. And that just simply means that in 7/20/21, my 6-month period now is over. And from July 1, 2021, if I ever wanted to pick up a Medigap policy, now I have to go through underwriting. The insurance company is going to ask you 25 health questions. They're going to check all your medications to see what you're being treated for. Probably get a statement from your doctor as to your overall general health. And so that whole process is different. But the first 6 months, none of that applies. You can have anything that you want. But after 6 months, now I've lost that eligibility and now I have to go through underwriting. And if your health is still good, that may be a possibility. But if you have some serious health issues now, you're not ever going to be able to get a Medigap policy. All right, so that's the second risk that you run. And then lastly, Part D, which are drug plans and advantage plans, those are called C plans. You also have certain enrollment opportunities. And so that's a little bit different than Medigap policies. Where the Medigap, we had 6 months to get what we want. With drug plans and advantage plans, we only have 3 months. So in this example, we have January, we have February, and we have March. And we can enroll into a drug plan or an advantage plan during that period of time. But if I have not done so within that 3-month period, which means now from 4/1, in my example, 2021 on, if I want to pick up a drug plan or advantage plan, I cannot until open enrollment period for Medicare, which is October 15th through December the 7th. So I can add a plan during this time, but that plan will not start until January 1 of the next year. Okay? And so if I don't take one the first 3 months and I choose to have A and B only, now I can't get a drug plan or advantage plan and coverage until January 1 the following year. So as you can see, you certainly can make the choice to have A and B only, but there are some consequences, and some of those consequences can be very painfully financially for you and limit your options in the future as far as Medicare decisions are concerned. To learn more, watch the related video or check out our most recent video. Also, be sure you click to subscribe for free and get notified every time we post a new video. To watch our complete Medicare workshop, go to MedicareSchool.com. And finally, when you're ready to compare all your insurance options and get free enrollment help from one of our Medicare School guides, call the number on the screen. See you next time.